This is Peter Voorhees from Atrium Health Living Cancer Institute. I had the opportunity to present the long-term follow-up from the CARTITUDE-1 study at the annual American Society of Clinical Oncology meeting in early June of this year. As some of you may know, CARTITUDE-1 was a study that evaluated the BCMA-targeted CAR T-cell therapy, cilta-cel autoleucel, also called Cilta-cel, and I'll refer to it as Cilta-cel going forward, but commercially is known as CARVYKTI. And this was a study that was conducted in patients with heavily pretreated multiple myeloma that had relapsed many times over and had become increasingly resistant to therapy. So the high-level takeaways of this presentation were that a third of the patients that were treated on this study with Cilta-cel CAR T-cell therapy remained alive and free of progression from their multiple myeloma for 5 or more years following a single infusion of Cilta-cel CAR T-cell therapy, and that was with no application of maintenance therapy or any other myeloma-directed therapy after the CAR T-cell infusion. With longer follow-up, we know that half the patients were alive for 5 or more years. And remarkably, for those patients that remained alive and progression-free for 5 or more years, when we did serial minimal residual disease assessments of their bone marrow, so looking for the needle in the haystack, and whole body PET CTs, in all of these cases, the patients were MRD negative in the bone marrow and in a complete response by PET CT imaging, again, 5 years or more after their Cilta-cel CAR T-cell therapy without additional therapy, suggesting the potential for cure or, at a bare minimum, unprecedented durability of complete remission. So just to provide you with some context as to what we would typically expect, from a progression-free and overall survival perspective, for similar patients, the Locomotion study was a prospective registry study that looked at expected outcomes for patients who had received previous CD38 antibody therapies, proteasome inhibitor-based therapies, and immunomodulatory drug class-based therapies. And what you can see here is that the median progression-free survival was only 4.6 months. Now, the CARTITUDE-1 data have been presented and published numerous times over the years, and we already know that the median progression-free survival after Cilta-cel in CARTITUDE-1 study is 34.9 months, which is much longer than the 4.6 months we saw in the Locomotion study. And with a median follow-up of just 33.4 months, we had not reached a median overall survival yet. And not surprisingly, we see this over and over again in the myeloma scenario, sustained minimal residual disease negativity translates into prolonged progression-free survival. So the focus of this study was the long-term 5-year follow-up from patients that participated in this study. So this is the study design, which may be familiar to some of you. So this study was conducted in patients who had relapsed or relapsed refractory multiple myeloma. They had to have had 3 or more prior lines of therapy or have disease that's resistant to both a proteasome inhibitor and an immunomodulatory drug such as Revlimid or Pomalyst. And they had to have had exposure to at least one of the proteasome inhibitors, one of the immunomodulatory drugs, and one of the CD38 antibodies. Patients had blood collected at the time of leukapheresis for CAR T-cell manufacturing. Patients could then go on to bridging therapy if necessary. All patients received 3 days of what we call lymphodepletion chemotherapy with fludarabine and cyclophosphamide, which is standard for CAR T-cell therapy. And then patients underwent Cilta-cel infusion. Now, the CARTINUE study is basically a long-term follow-up extension study for CARTITUDE-1 and is the focus of this particular presentation. So 97 patients were treated with Cilta-cel in the CARTITUDE-1 study. Unfortunately, 46 patients have progressed. 13 of those are on the long-term follow-up study, CARTINUE, But remarkably, of these 97 patients, 32 or a third, are progression-free of their myeloma and alive for 5 or more years after their Cilta-cel infusion. And these participants are also in the long-term CAR-T study in follow-up. So this is the progression-free survival curve. And to make a long story short, if you go out 60 months or 5 years, you can see here that 33% of the patients remain alive and free of progression from their multiple myeloma, which is really quite a remarkable result. Again, there was one center that happened to enroll a lot of patients into the study, and for any one of those patients from that center who had achieved at least a complete response, they had yearly bone marrow assessments done for minimal residual disease, and they had yearly PET-CT scans done as well. And in all 12 of the patients who had achieved a complete response from this center, all of them remained clear of disease from a PET-CT perspective for 5 years or more after their Cilta-cel infusion, and all of them remained minimal residual disease negative at the 5-year mark or longer, suggesting again this potential for cure in some of these patients, or again, at a minimum, unprecedented durability of complete response. What's really interesting, we looked at the baseline characteristics of those patients who managed to remain alive and free of progression from their myeloma for 5 or more years versus those that relapsed within 5 years of receiving their Cilta-cel. And there were a similar number of patients who had high-risk chromosome features associated with their disease in the two groups. And there was a similar percentage of patients who had extramedullary multiple myeloma, in other words, myeloma that can grow outside of the bone, which suggests that high-risk features at baseline don't necessarily predict who's going to be one of those patients that's alive and progression-free 5 or more years after receipt of Cilta-cel CAR-T-cell therapy. The other thing that was very interesting is that for those patients who remained alive and progression-free for 5 or more years, they had a lower burden of myeloma in their bone marrow compared to those that relapsed within 5 years. So the amount of myeloma in their bone marrow was 5% for those that did well with long-term follow-up versus 24% for those that progressed within 5 years. So it suggests that, if we can control the disease better going into the CAR T-cell infusion, that helps improve the odds for one of these long-term remissions as shown here. We did some correlative analyses as part of this study as well. This is all very complex. To make a long story short, when you look at characteristics of the CAR T-cell product before it's infused into the patient, and when you look at the characteristics of the CAR T-cells that expand, after you've infused the CAR T-cell product into the patient, what we saw is that those CAR T-cell products that consisted of more immune fit profiles were more likely to translate into these long-term, good outcomes where patients are alive and progression-free for 5 or more years. So a more immune fit CAR T-cell product translating into better long-term outcomes. Now, with 5 years of median follow-up at this point, the median overall survival in this particular study is 60.7 months, so just over 5 years. Now, in that locomotion study that I told you about at the beginning, the expected median overall survival for a similar patient population is only 12.4 months. So 60.7 months, far surpasses of what we would traditionally have expected in this group of patients. So this is really an unprecedented survival, benefit that we're seeing in this particular study with long-term follow-up. Now, certainly we don't want to be dismissive of the potential side effects that are associated with Cilta-cel CAR T-cell therapy. What I'm reporting here is any new safety events that had not been reported previously. So the last time that the safety from this study was reported was back at the ASCO meeting in 2023. So with an additional 28 months of median follow-up, we didn't see any new cases of Parkinsonism, and we saw no new cases of cranial nerve palsy, such as Bell's palsy. Now, we saw those in earlier looks at the data in some of the patients, as has been reported previously, but with longer follow-up, we did not see any additional new cases, which is reassuring. There were 2 new cases of secondary primary malignancies. One was a lung cancer, and one was a cancer involving the anus, neither of which were attributed to Cilta-cel CAR T-cell therapy. There were 2 neurologic events that were seen. One was a case of encephalopathy after IVIG therapy, and then there was someone who had a very mild taste disorder that was not attributed to Cilta-cel therapy. There were only 4 new onset grade 3 infections with this additional 28 months of follow-up. There were no grade 4 or grade 5 infections that were identified, and of those 4 grade 3 infections, none of them were attributed to Cilta-cel. So that risk of infection after CAR T-cell therapy is really, most important in the first 3 months in particular, but I would argue over those first 12 months as well. So just to conclude, in this study with long-term follow-up in the CARTITUDE trial, for the CARTITUDE 1 patients, a third of the patients who would historically be expected to have a median progression-free survival of less than 6 months remain progression-free and alive for 5 or more years following a single Cilta-cel infusion with no additional myeloma therapy applied subsequently. And again, of those progression-free patients, 12 from a single center, with serial minimal residual disease testing and PET-CT imaging, were in complete metabolic response and MRD negative for 5 or more years, suggesting this potential for cure in some of those patients, or again, at a minimum, unprecedented durability of complete response. These long-term remissions were not limited to standard risk disease. We were equally likely to see them in patients who had high-risk chromosome features and those with extramedullary disease. And then, as I mentioned before, patients in long-term remission had more immune-fit CAR T-cell products, and they had better control of their disease going into the CAR T-cell infusion. So the more we can optimize those variables going forward, the higher the proportion of patients who can enjoy these long-term benefits. And then lastly, the median overall survival of 5 years really sets a new benchmark for this patient population. Now, going forward, as I alluded to earlier, we would expect, that more immune-fit CAR T-cell products and the availability of more effective bridging strategies to control the myeloma will translate into a higher proportion of patients who are enjoying these incredible outcomes. And CARTITUDE 5 and CARTITUDE 6 are randomized studies that are actually evaluating Cilta-cel as part of frontline therapy for patients with newly diagnosed myeloma. CARTITUDE 5 is evaluating its use for patients not undergoing an upfront transplant, and CARTITUDE 6 is looking to see if Cilta-cel will outperform transplant for patients with newly diagnosed myeloma who are considered transplant candidates. Again, we think we'll have better disease control in the frontline setting. We expect the immune system to be more fit earlier in the disease course, and we're hopeful, that we'll see potentially more cures in these particular studies. But obviously, it will take a lot of years of follow-up to determine if that's the case. But really very exciting times, for patients with multiple myeloma. So with that, I'd like to thank, my co-investigators on CARTITUDE 1 and the CARTINUE study, Johnson & Johnson and Legend Biotech for their support, and last but not least, all of the patients who participated in this study and allowed this to become FDA approved and available to more patients going forward. So thank you for your attention.